Okay, distinguished guests, good afternoon and welcome to the session Global Health Architecture Post-COVID-19. My name is Björn Kümmel. I'm working for the Federal Ministry of Health, Germany. I'm currently leading the Global Health team, and it's an honor to welcome you to another very, very interesting session here at the World Health Summit. My ministry is a long-term supporter of the World Health Summit, and we indeed are very, very interested in setting up formats that will not be having too many PowerPoint presentations, in this case, most likely none, but rather we are aiming for frank discussions among the panelists, but also among with you, the audience, because we'd like to be inspired by you. And the main idea of the session today is to more or less pick up on discussions that are being held in Geneva or elsewhere, have a Berlin vision or a Berlin inspiration on it, and in order to enable us, the German government, then to go back to Geneva or elsewhere with the information we gained through this session. Now, on the topic, Mike is here, just coming back from the Parliament. Great to have you with us, Mike. You're over there. No worries. So the topic, why did we pick this topic? The main idea of today's, of this session is to focus on what is our vision for global health architecture and why have we picked it? In my words, we are currently experiencing most likely the most inspiring and innovative time of global health. The world post-COVID will look completely different, or is already looking completely different compared to the world pre-COVID. And obviously with regards to global health governance and architecture. So the main players might change, the power game in between the various players changes. New players are being created, like the fifth, for example. And the question comes up, who's in charge of what? How do we ensure a well-functioning global health architecture? And we are seeing this in Geneva. We are debating the financing of the WHO. Mike is just coming back from a session in the German Bundestag on it. We've created in Washington a new financing facility. We are replenishing the Global Polio Eradication Initiative, or we are replenishing the Global Fund with potentially a mandate on pandemic preparedness and response, etc. But we are looking at all this in isolation. We are addressing small pieces of a bigger picture, but we are not discussing the entire picture. And that was the idea of this session. So rather, because the fear is there that we are looking at all these pictures or puzzle pieces in isolation, but in the end, they have to make sense. So the big question that we are trying to address is, what kind of global health architecture do we envisage? Should it be more or less fragmented? Should it be obviously more efficient, more transparent, avoiding duplication, be truly inclusive, and obviously ensuring full coordination? And that's the idea of this session. So not just to focus on pandemic preparedness and response that we are doing, I guess, in many of the other sessions, but rather getting a broader vision, a broader picture. I'm not going to introduce all the panelists because that will be done by the moderator, who I'm going to introduce now. So I have the pleasure to have the chair of this session with us, Ilona Kickbusch. I guess I don't have to introduce her to this audience. The main fear that we have on the German side is what is actually happening if we don't have you with us anymore, because then we will be most likely not in a position to hold the World Health Summit as it is, and many of the other discussions that we are holding. So it's a pleasure to have you with us, and the floor is yours.
Thank you, Bern. I believe in healthy lifestyles and longevity, so maybe I'll be around for longer still. I hope the setup here is not a symbolic expression of the global health architecture. But this is what we are stuck with, and we'll try and live with it, and we couldn't reform it at short notice. But maybe this gives us some inklings of the difficulties that might be faced. I think actually I don't need to spend a lot of time introducing the members of the panel. You also, when I last looked, had them up there. Obviously with us is Helen Clark, who all of you know as the former Prime Minister of New Zealand, but of course has become an incredibly important voice in global health as the chair of the independent panel. And even though the recommendations of the panel are a while back, Helen is still stuck with global health and is trying to move it forward, and she'll give us some of her ideas about it. Of course, Larry Gostin, who's here with us, Professor Larry Gostin from the Georgetown University. You know that he runs the O'Neill Institute for National and Global Health Law. To some extent, one can say he invented global health law. And I have some of these books in my bookcases. At the time, you still bought books. But Larry has been an incredibly important voice in the discussion of global health governance, and particularly where institutions and treaties and laws and really the normative role of actors is involved. And that's why his voice has been so important. And he, of course, is an important contributor to the discussions on a global treaty, and you will probably share some of that. We have with us Dr. Mike Ryan from the World Health Organization. Everyone knows him. He's a media star, as you know. He runs the WHO Health Emergencies Program, and he's known to say it as it is, and his quotes are everywhere. So just having Mike here with us will ensure a very lively panel, I'm quite sure. And we have Dr. Harriet Kosa with us. She is with the International Planned Parenthood Federation and is a senior technical advisor in India, and will give us perspectives on global health governance from a civil society perspective. So we're reasonably gender balanced, I think. So that's already a good thing, which one can't say of global health governance. So at least that's symbolic. So without further ado, Helen, I would actually like to start with you, because your panel, I'll just call it that, of course, together with Ellen Sirleaf, has had a tremendous impact on the global health discussions. You put forward a whole number of recommendations. And we were just wondering, you know, it's about 1.5 years ago, as I said, your report. You know, looking at your report now, does your vision stay exactly the same given things that have happened? Or do you stick with it and say, hey, we came up with the right things, better do them?
Well, thank you, Ilona. We're actually not that dogmatic. I think our panel was a useful contribution to the debate, but there have been other panels and other proposals. And I think what we all want is the best out the other end for global health and health coordination. It's also true that over the years, faced with emerging challenges or changing priorities, there's been a tendency to create completely new vertical institutions, and we don't need to go further on that. But I think over the next year, as we work towards good declarations out of 2 high-level meetings, a high-level meeting on UHC and PPR, that's also an opportunity to locate PPR firmly within the universal health coverage agenda as well. So I think we've always got to be looking for the links and for the coordination. I think the fact that there are so many challenges at the moment to global health, and we don't need to elaborate what they are. I mean, Ukraine crisis has come like a train wreck on top of that, with the food insecurity issues and the implications of that for health. But I think at a time of turbulence and challenge, it's also time to be pressing on reform, because, you know, we can easily have our attention distracted if and when things settle. From the perspective of the panel, a lot of the key recommendations we made, there've been very active member state processes around them, and I think that's terrific. The negotiation processes in train around the Accord, the work now being done with a new IHR review committee, which will lead to a process. Obviously, there's a fifth, and while we would have designed a little bit better, hey, there's going to be some money to hopefully do some real things with that. I think one of the probably more controversial and difficult issues is how to take forward the range of proposals for a pre-negotiated platform for countermeasures. That's quite complex, but obviously needs to be done. And then there's the issue of governance, which we can come back to later. So, no, all in all, I'm happy that a lot of discussions are in train, and I think something good is going to come out of all this for global health.
Thank you, Helen. So you're describing a very dynamic scene with many different actors, still a number of proposals, but also great opportunities, thinking of actually the two summits, the plan for a pandemic summit at the UN and the UHC. And actually that's a wonderful opportunity to hopefully at the UN level bring these two agendas together and move us forward. Larry, Helen mentioned the fifth, and here in Germany from the G7, we have the Pact for Pandemic Readiness. We have other such initiatives out there. So there seems to be a tendency in global health, you have a problem, you create a mechanism and an institution. And the last 20 years, this has expanded considerably without proper coordination and relationships. So how do you see this moving forward? Would perhaps, at least in the area of pandemics, the treaty help, bring some of these things together? Is the treaty, again, something we need to see totally differently? What would you see we should be able to do to gain more coherence? I mean, Anne-Marie Slaughter says, just live with the fact that you have so many organizations and build a network governance structure. What do you think?
Well, Anne-Marie might be right. I mean, nobody can quite fix this mess that we're in, but I would say, Bjorn is, in my mind, a hero. I mean, you actually rescued the WHO financing. But I'm going to correct one little thing you said, which is that it's not the most important global health time of our lives. In post-war was. We had the Universal Declaration of Human Rights. We had the WHO Constitution. The very first treaty that WHO adopted was the International Sanitary Regulations, which is now the health regulations. But I will say that we are now in an incredibly historic moment. One is because of WHO financing, which you single-handedly rescued, in my view. The other, as Alona said, was the pandemic instrument and the international health regulations. I'm just for disclosure, I'm on the IHR review committee, so I have to be somewhat circumspect. But I think we have an opportunity now that we haven't had in our lifetimes, in generations, to really make something of this. In answer to your question, I think it has to be WHO at the center of coordination for many reasons, but the most important is that in the post-UN era, which is where we need to reference ourselves to, the WHO Constitution calls WHO the leading coordinating organization in global health. But with so many partners, WHO has to be at the center of it, but they have to coordinate. And I think the pandemic instrument would be a really good place for them to do that coordination. But the important thing I wanted to stress is that I consider myself the most loyal friend of WHO, but friends tell hard truths. And I think the hard truth is that we need to get better governance at WHO. And I think Tedros is doing a fantastic job of that. We need to have more honesty and stewardship, transparency and openness. Most important, inclusive participation, because WHO is really stuck as a UN agency, and it hasn't had the kind of freedom that, Gavi or the Global Fund or others have had, with a lot of shared governance. Effective performance, monitoring, benchmarks, quality improvement, accountability, and the most important thing is equity. What COVID taught us more than anything else is that we really need better mechanisms. The ACT Accelerator was an ingenious idea, but it didn't deliver. And I hope that during the session, we'll have time to talk about, because we're doing a project for WHO on models of equity and for the INB. And I hope we can get into that.
Thank you very much. And thank you for also mentioning some of the other bodies that have been created and where people are discussing, should they continue, should they be ended, should they in themselves be reformed. As a chair, I might correct you a little bit. I don't think the ACT-A didn't deliver at all.
No, of course it didn't.
It didn't deliver equitably, and it delivered too late.
Exactly.
So just to be precise on that,
I agree.
because that's an important qualification if we're thinking about should it be continued or not. But you've mentioned one thing, and that's where I'd like to turn to Mike. Mike, I'm here. In this context of global health governance, and particularly in the context of the pandemic, this notion of trust in organizations has moved to the forefront, and there have been a whole range of criticisms of the WHO, partly of its leadership, but partly those were proxy fights as well, of a general dissatisfaction with the multilateral system, or other more geopolitical issues at stake. So, but still WHO is faced with the problem. It's got to reestablish that trust in international organizations in itself, and with social media everywhere, and we've had some of the demonstrations before this hotel also, the trust also of people, that they understand what WHO is on about and why they need it, because they vote for the parliamentarians that you just visited, that vote on the money that WHO and global health gets. So Mike, can you give us some ideas around this trust issue of international health?
I don't know if that's working. It is? Okay, good. Yeah, I think, first of all, we need to take a step back. The ultimate responsibility and accountability for the health and welfare of a population lies with the sovereign governments of the world. Barack Obama once said that if people cannot trust their government to do the job for which it exists, and that is to protect people and to promote their common welfare, all else is lost. And I certainly saw that during the pandemic. So everyone needs to look in their own eye and see where the failings were in the pandemic. It's very easy to look at multilateral institutions or UN institutions. Oh, that was, the fault is all there. There's plenty of blame to go around in this pandemic, I can assure you. The issue of trust, and we all know that, takes years to build, minutes to lose, and forever to rebuild. And it's about who trusts whom in the system. In fact, if you look at surveys that have been done in places like Spain, the World Health Organization has actually gone up exponentially in the level of trust offered by ordinary citizens too. Yes, if you want to go to some populist governments who beat up on WHO, and some of the more venal media who just like taking a pop at anything that puts its head above the parapet, then you'll get another view of the world. And there's many unelected individuals around the world who live in their little white northern cabals who like to sit in rooms and decide what the future of global health is going to be. The reality is 194 ministers of health come together every May in Geneva, and they set out under the democratic principle, what are the policies for the world? And we need to continue to invest in that. That is truly governance. Now, you're right, Larry, that needs to be adjusted and updated. But the idea that other fora in which that happens in dark rooms, where that doesn't happen transparently, where people think by the very money they have more. No, the more money you have, the more influence you have, the more you should be using that money and influence to support what we, the people, decide is the future for the earth.
That's right.
Right? That's your responsibility and accountability. Yep. Use your money and put it into what we decide we want to do for ourselves, for the next generation. Not that your money or your influence gives you the right to decide for everyone else. That's not the principle I want here. We're a flawed organization, but we are radically transparent that we are open through the executive board at the World Health Assembly. Everything we do is on the table. Everything we do is out there for criticism. I wish it were the same for other entities and institutions. And I think we should continue to be radically transparent, Larry, and build that trust, right? And be prepared to be criticized. We serve. I said it this morning. I don't serve government. I don't serve multilateral institutions. I serve the pregnant women in Pakistan, the 70,000 a month who are going to deliver in those floods over the next 6 months. 700,000 women. I serve the people who are dying today in Congo or in Ebola in Uganda. And I serve those frontline health workers who are going back into those Ebola treatment units. That's who I serve. And I'll be very radical in that service. And we need to be able to do that more and more. We need governments to engage and drive that. And Bjorn, thank you for your leadership in driving that. Helen has been someone who's kept me sane at various times during the pandemic. I have a kind of a counselor at times that settles me. And thank you. I've never get a chance to thank you in public, Helen, for your kind messages during the pandemic. But there have been times when I've had to be peeled off the ceiling. She's been one of the peelers. But we're in this together. But we have to go back to that principle of service to the people we serve. We're all sitting here in this room. We're all privileged to be here. Do we understand that privilege? Do we understand the accountability that comes with that, the trust that people have put in us to be here on their behalf? And are we going to go and re-deliver that? And that's trust, Ilona, that building and continuing that trust. And it does require radical transparency and the acceptance of criticism, Larry, absolutely. But it also, I think, requires the broader multilateral system to come together and stop competing and stop neutralizing each other in these arguments consistently. Thanks.
Thank you, Mike. And I do remind us of the word geopolitical that I think was in the title of this event. And I think we might come back to some of those elements around the decoupling. And I indicated the proxy fights, blame it on someone else so that people won't look at you in greater detail. But still, there is the issue in the room also in relation to WHO, and I was speaking to somebody over lunch about that, is the voice of civil society and, how that can be better heard, how can that be better included, organized, etc. And I think it's something that raises its head again and again, the type of engagement that is also possible in global health, which is very different for different organizations. Obviously, some have, boards on which NGOs also serve, like the Global Fund, etc. But could you say a bit more, Kosa, about this, the intention, the wish of civil society to be present at the governance table, smack in the middle of it?
Yes, so thank you. And the first word that I want to say is equity. And thank you, Larry, for talking about it, because I thought I will be the only one talking about it. And how do we see civil societies and communities? We talk that there are processes, we talk that there are so many engagement mechanisms. But I think what the need is to make them more transparent, inclusive, and equitable. Let's not forget, let's not move equitable from the center. And what, I thank you, WHO. There's a handbook of social participation. If you all have got time to read it, it talks about social participation, but how do we fully achieve it? Are we making it truly participatory for communities to come up and talk, for civil society to voice their opinions, And like yesterday town hall with Dr. Tedros, I think that's an example I'll take. At least there was a town hall, you know. And if we are moving ahead, how do we make or how do we create more such spaces? How do we ensure that communities that sit or engage on these spaces are actually able to translate the community intelligence that they're bringing along with them? And lastly, all these discussions are nothing if it is not translated into any policy, or, you know, we are not able to make any changes in the system. And I also want to thank Helen. You know, I really like the word new verticals. You know, there are so many platforms which are working. And thank you, you know, for talking about ACT Accelerator. And, you know, there are so many platforms. We just need to, what I personally feel is we need to optimize, maximize. These are investments. We cannot just say that this model wasn't good, let's change it, or let's get a new one. How do we optimize it? We are working in, you know, we are working in resource constraints. We have so many crisis situations that we have to address, but how do we build up on these mechanisms? That's the question. I want to share two examples of which I am engaged with, like the civil society engagement mechanism for USC 2030. You know, I want to say that we have constituencies, we have people from private sector, government, CSOs, communities. We all sit together, we all reflect and monitor, you know, what progress are we making? I also want to talk about ACT Accelerator. You know, I've been engaged in it since the beginning as a community representative, but I also want to say how we worked. You know, ACT Accelerator was created within 3 months. As WHO declared coronavirus pandemic is here, we were there on Zoom calls, you know, so many of them struggling with COVID. That time we didn't know it's long COVID. Now we know, but still we are figuring out what to be done about it. But still, at least we are talking about it. And we had an unprecedented collaboration at global level. But I think it needs to be translated to regional or country level, and domestic investments is, I think, the key to it. And lastly, I want to also say that I really like the word historic, and that, you know, we are at a historic time. But I think LMICs, you know, we need people who are actually there on the field to talk about it as technical experts, as, you know, bringing voices and to the table, and then we, you know, together we discuss and co-create our future. I think that is my last request to the panel and to the audience. Thank you.
Thank you very much, Harjata. I'd like to get back to you, Mike, for a minute, following up from that, and also, interestingly, something Larry didn't say. He referred to the WHO Constitution and referred to the coordinating role of the World Health Organization. And despite talking about the treaty, he didn't talk about the normative role of the World Health Organization.
It was in my note.
It was in your note. Good. So next book you write, there it's going to be. But the reason I've raised that is because, of course, models of participation relate to that. You know, the Global Fund can have, you know, everyone and sundry on its board, if I just put it simplistically, because it doesn't set norms. And the question is always, you know, do you put those people on your board who you're going to regulate? So could you say a little bit, particularly also in relation to the pandemic treaty, where, Mike, you have also organized, you know, open discussions with people all around the world, etc., in terms of, you know, here is a one and only normative organization. And what does that actually mean in terms of the relationship to others?
Yeah, it's interesting because, yes, WHO has a really important role to play in setting norms, standards across such a wide range of health issues. But again, remember, in that, WHO is not doing that inside a secretariat. We're doing that through a process of consultation with member states, with expert committees. It's a platform for creating norms and standards, and it's a co-creation of those standards with that oversight process of creating the independence and all of that. But it's also a straitjacket, because the number of people who've looked at me at meetings said, WHO is a normative agency, you should stick to that. and let us get on and do the other stuff. And frankly, I reject that out of hand. So on the one hand, it's a very important role for WHO. On the other hand, it's a straitjacket that's applied to WHO at times. And it's interesting, you know, with all these agencies, and they're really important. And just, you know, while I have the floor, I mean, you know, we have ACT-A. Within ACT-A, we have the COVAX initiative. I mean, you know, 80% of the vaccine that went to low-income countries came through COVAX. That's the reality. And people like Seth Berkley at Gavi, and people like Richard Hatchett at CEPI, and all of the other people in our programs like Kate O'Brien and Anne Lindstrid and Anna Maria Hanau and Soumya Swaminathan and others who worked 26 hours a day for 2 years to make that a reality, deserve a huge amount of credit for the effort they made in the spirit and in the pursuit of equity. And this is a big problem in London. So it failed. You ask why something failed. Did something fail, or was a qualified success because it was badly designed or delivered, or because the world wasn't ready to support that approach? And any failure that happened in COVAX happened because countries did not want to share. That's right. Not because COVAX was badly designed. And we get this self-flagellation stuff that goes on. Oh, we failed. Why? Ask the question, why did we fail? We failed because of the greed of the North. We failed because of the greed of pharmaceutical industry. We failed because of self-interest in certain member states who were not prepared to share. And COVAX went against that trend. And COVAX tried in its best way to represent that need around the world. So people like Seth, people like Richard and others, you know, and their teams deserve huge credit. And the multilateral institutions that came together under Dr. Tedros' leadership, I've never seen that before. Organizations willing to sublimate their own individual organizational reputations. Every single Thursday since the first week of this pandemic, the heads of those agencies have talked together from 6:30 to 9:30, 10 o'clock at night sometimes. The heads of agencies. How can we fix the problem? How can we get more vaccines? It's not perfect. And there have been times you want to scream with some of the bureaucracy and everything else. But it's an incredible step forward in that regard. So, and the last thing I will say is when you get to country level, everything changes. The Minister of Health said to me, during COVID, he said, I have 84 separate international health organizations with representation in my capital. What the hell do I do with that, Mike? It sounds great here. We're having side meetings and bilaterals and different organs. It's fantastic. It's speed dating for global consultants, right? You get down to the country level, you have one Ministry of Health, usually underfunded, the weakest ministry in government, right? With local NGOs and others. It's hard. And then we come in with our vertical systems and we start pushing everyone around. So you must do this and you must do that. We have decided this is best for you. How paternalistic is that? So I think we have to change the game in the way in which we consult, and within that civil society as well at national level. So I do think we need the multilateral agencies, we need the multilateral system, but we need more discipline in that system to actually deliver what people in the front line need, what communities need. And sometimes our egos get in the way of that. Our institutional ambitions get in the way of that. And it's time for a little bit of humility on behalf of the multilateral system to actually understand what's needed at national and subnational level.
Thank you, Mike. And it actually relates back to something you said about trust, because also that humility and that mirroring back into society, what is actually happening at different levels is a very important element of that. You know, we had a discussion this morning with some colleagues who absolutely hardly knew anything about the humanitarian, if I can call it that, work of WHO, to be the only agency left in a period of distraught situations, be it Sahel or Sudan or elsewhere. People just don't know about this. And obviously WHO doesn't have the money or the legal right to do the kind of marketing that other international organizations can do. And I can tell you, and I'm sure Björn can tell you, how the interest in global health is fired up just before a replenishment of one of the other organizations, with parliamentarians getting I don't know how many visits, but you know, that's not something that a UN agency does in that way. So I think, this attention seeking, attention grabbing, and what I call, the marketplace of global health, where it has become competitive, is really something that impinges on both on governance, but also on how organizations are perceived. Helen, could you add something to this discussion in terms of what Mike said, but also, in your report and also when you speak, you often, you put WHO in the center. You say we need a strong organization. I think at some stage you called it the nerve system of global health. Having listened to Mike and also, as a former head of government, how to best approach that to make it better?
Well, WHO has to be the nerve centre for all the reasons that Mike has given. Because of all the bodies in the global health pantheon, no one else has the ability to make treaties, draw up conventions, set norms, and so on. This is a leadership role. But I agree with Mike that you can't then swing around and say, well, the role is only normative. And it reminds me of a debate we used to have in the New Zealand government where it went through a phase of the Treasury wanting to cut up every department and divide it into policy and then another one that did operations. And I used to say that policy that wasn't informed by the reality of operations would never get it right. And similarly, operations not linked to a policy function would be operations without a brain. And I think that's the reality for WHO. So WHO, in drawing up its policy and guidance, is very much informed by this incredible network that it has at the country level. The country offices, I was at UNDP, the country offices are your strength, right? They're your heart, you're your soul, and they're what you build on at the coalface with the emergencies. So I think, for all these reasons, and also, as Mike stressed, for the accountability reason, that WHO is a member state-owned organisation with a clear accountability back to them. Other players don't have that. And just with respect to the comment that was made about, how much is spent on branding and marketing around replenishments, it reminds me that I think the common wisdom is that pharmaceutical companies spend more on branding and marketing than they do on research and development. It'd be very interesting to look at the scale of the branding and marketing budgets of some of the competitors in global health, whereas WHO is getting on honestly spending the money on global health. Now, so in making it the nerve centre, it has to be empowered, and I think there's a couple of points I'd like to highlight about the empowerment. One is the sustained, predictable financing, and I endorse what Lawrence said about Bjorn really doing an incredible job shepherding the member states towards agreement that over a period of time they will fund 50% of the base program through assessed contributions. I think this is critical. I mean, obviously, ideally it would be higher. I think the concept we had in the independent panel report of a replenishment process to raise the rest for the base program would also be helpful. But this is just a major step in giving the WHO the flexible and predictable funding to be strategic in what it does. Now, of course, the quid pro quo, I think, in the resolution was that WHO was asked to be even more transparent and accountable. All fine. But the key thing is it's now got its financing a bit more anchored in the reality of what it needs. And then there's the issues of the empowerment. I mean, the view of the independent panel was not that WHO failed the world. No, member states failed the WHO. This is clear. The WHO does need more powers to deal with pandemics. And I put it to you, isn't there something ridiculous about the fact that the International Atomic Energy Agency can go into a war zone and inspect what's happening in a nuclear power plant, and WHO doesn't have an absolute right to get visas to go to the site of any outbreak anywhere in the world? This is wrong. So I would be looking to really the international health regulations to be made fit for purpose and empowering the WHO on very practical issues like that. I think that's critical. I think just perhaps to conclude with one point, you know, and going back to the policy operations thing, WHO has to have an emergency program. Has to have a strong emergency program because it's building on these strengths that it has at the country level and the expertise of those who gather around the program. Look, it may be that within that there are some tasks that others could do better. I'm not the expert on this. Procurement is always a tricky area, but there's no question in my mind that it can't only be technical, normative policy, because that would not then link it to the realities of what happens at the country level. Back to you.
Thank you, Helen. And I think we sometimes forget how young that program is. I happen to be on the panel that's suggested the establishment of this program. And actually, you know, after the Ebola outbreaks, and this is, you know, the first major pandemic that this program is dealing with. And I think also here, there is an enormous boost of learning that has gone on. You know, somebody called COVID the learning machine. And so that is also something we have to take into account, and where some member states are obviously questioning this, but the support, particularly in the World Health Assembly 2020 resolution, was very, very clear that this is a key role of the WHO in the 21st century. So, Larry, where do you see those roles? You know, WHO smack in the center, nerve system, all of that. And, you know, looking at it a bit from your treaty eyes as well, being involved in that, what need to be key elements that we really grab at this point in time? If it's a historic moment, I like to speak of this cosmopolitan moment, and people tease me about it. But Larry, please give us some indication what you think must be done through a treaty.
Yeah, I mean, and I've taken note of what Helen said on the IHR and on the treaty. You know, there are a number of things I think that, you know, both of them, both processes need to do, and they also need to be coordinated. I mean, one is that when there's an outbreak, we do have to have access. We have to understand, as Helen said, the origins, and we can't have countries, you know, blocking that. We need to make sure that equity is at the center of this. I wanted to say a little bit more about that because we're doing a project for WHO on equity models and the INB. At present, you know, the normative functions of WHO, one of the things that's been really quite successful but has been, you know, overlooked is the PIP framework, the Pandemic Influenza Preparedness Framework, which is basically, you know, has the same heart, if I might say, as the ACT Accelerator. It's there to share information, scientific information, and also to share benefits. So I'd like to see something, whether soft law or we can put it in the treaty or the IHR, would be really important, that would try to kind of solidify this legally. The other thing is that, you know, we've been, as Mike was saying, you know, so much of the blame for this is on rich countries. And one of the things I thought you were going to ask me, Alona, was this horrific geopolitical struggle between China and the United States. We're going to come back to that, you know, where I thought that my president, Trump was not my president, but I wrote an op-ed in the New York Times at the time saying it was the most ruinous presidential decision of my lifetime, the decision to withdraw. And I talked to Joe Biden afterward. On day one, he reversed that. You know, we've got a sane, kind human being in the White House, thank God. But the model in which poor countries have to or middle income countries have to go hand in hand to richer countries for charitable donations. That's got to end. And one of the things that we haven't mentioned, but what I love, Mike, is your and Tedros's and others' idea about the mRNA hubs, one in South Africa now, and I hope to see more. We have to change the incentive system for intellectual property, number one. We need to share scientific information much more expeditiously and kindly and without self-interest. And we need to transfer technology so that low and middle income countries have the power, they're empowered, and they have the capacity and the funding and the technical know-how to make their own medical resources. That has to be vaccines, therapeutics, personal protective equipment, diagnostics, a whole range of other things. And so in my view, it's an antiquated system where rich countries just get to keep all the marbles and then wait until there's enough supply to kind of give. And the same thing with pharmaceutical companies. They think they can give charity. And I think the charitable model has got to end. And there's so many more things that we need to do with the IHR and the pandemic treaty. But for me, those are really important parts of it.
Thank you, Larry. And obviously, I would agree with many of those, particularly the end of the charity model, which is a theme that is now really coming up more and more. Because obviously, as important as ODA is, as it helps drive this marketplace of replenishment, etc., it's a drop on a hot stone in terms of what happens in countries, and something much more sustainable and deep actually has to happen if we think around investments in health. So, Harry-George, I'd like to come back to you. You know, you indicated we want more voice. We want to be present. We don't just want to be invited. We want to engage. We want to be sure that we have a role to play. And there's been, an innovation in WHO called FENSA, which has not satisfied the NGO community. Maybe you want to say a word on that, but at the same time also say, what is the key agenda that is driving the NGO community? Because we see on the one hand a very active NGO community. I'm just thinking of the polio event yesterday. When did we have the most clapping? When the money came in for polio. We didn't have the same amount of clapping when the DG mentioned that the member states are going to increase the funding of WHO. So, something's got to give. So can you say something about that? The focus also of the NGO effort?
Yes, thank you. And I want to start with talking that what other, just mentioned, that we as civil society, as communities, we also, we want to echo the same, that WHO is a key player, and it has, helped in strengthening the mechanisms of community and CSO engagements, be it what Helen was mentioning, INB, or strengthening IHR. We cannot just overlook these engagements. However, what you just mentioned, that, these requests should be timely. It should not be a last minute thing, that I'm talking about generally now, that how do we plan a session? We say, we have a gender balance. We also think that we have representations from all communities. We have representations from all regions. Oh, let's get somebody from LMIC. We have to think like beyond that, how do we actually, why are we actually inviting? We are not inviting to have just a well-decorated panel. We want to understand, how are we planning all these interventions? And when you talk about mechanisms like FENSA, I want to say it's a beautiful mechanism, but is it getting translated FENSA has 5 steps. How many of us know that? And especially the last one, which talks about monitoring the engagement. Who is monitoring? Is that engagement being monitored, which is community led or communities monitoring? And when you come to types of engagement, which FENSA mentions, I think last 3, when it talks about advocacy, when it talks about evidence and technical collaboration, CSOs and communities, like it cannot be done without us. And that engagement needs to start early, that's first point. Second point, how do we look at it? Like there are a lot of mechanisms in which we are able to engage, but what about non-member state actors who are not in official relationship with WHO? I think yesterday's town hall, I'll again give an example, was a good example, but we need to have more such platforms. It's not that CSOs and as communities, we want more, is that we want to make it more meaningful. We are, I would say first, the word I was using was principle of equity, but thanks, Ryan. I will use the word called spirit of equity. And that spirit is, mostly very infectious. We'll come to know that is it spirit or is it just, we are tick marking a box of, that yes, we are working on principle of equity. So
thank you very much. I'd like to use this opportunity to actually bring in a question from the floor. It's from Mike Podmore, and he says, I echo the critical importance of WHO and the need, and I won't read out all of that. He says civil society would be better able to fully back WHO at the center of global health if it had more voice within its decision-making, echoing what you just said. Can each of the panelists suggest one key way that we can ensure greater direct voice and involvement in decision-making and governance oversight in the WHO and all other key global health institutions? I think that last bit is taking it a bit far, because since they're governed differently, identifying the mechanisms would also be different. But maybe you can give a short idea in terms of how can this voice be better heard. Could you start, Larry?
Yeah, I'd love to start, because I agree that about the importance of civil society. I mean, just outside yesterday's opening session was a big protest about, climate justice now. And a German reporter asked me, they said, well, but the people inside believe in climate justice, so this is no good. And I said, so he said, what do you think of the protesters? And I'd say, it's great. I mean, we need to have radical civil society voices pushing us. I was actually in the CDC war room when AIDS was first reported. We didn't know it was AIDS then. AIDS changed the world. And it changed it from the bottom up, social mobilization. And I think, WHO needs to harness that. It's really important for WHO to have that, to have civil society voices actually backing them, pushing their governments to do more for WHO. And that's not happening. You see it happening even with UNAIDS, which is a UN organization, certainly the Global Fund, to a less extent, Gavi and others. So we need to get that kind of harness that voice, this idea of nothing about us without us, I think is really crucial. And the way that AIDS changed the world is that, we like to think that, civil society, well, you invite them in, it's a good thing, we want their support, but they're probably the smartest people in the room. And I saw that in the AIDS context. They came in and they were telling Tony Fauci what, about AIDS. And so if I were to change one thing, I mean, there would be many, many with WHO on and inclusivity, but it would be this idea of official relations, because you have to be a bigger organization, a well-funded and international organization that leaves out the little guy. And I also think, and I tweeted it yesterday, I love that Tedros did that town hall. I think more of that would be great, but we've got to really bring civil society into the tent in very profound ways. And I think AIDS taught us that.
Thank you, Larry. Mike, you started listening to more voices in the treaty negotiations, for example. There was a lot of things going on there virtually and else in other ways. But what would your answer to Mike Podmore be?
It's again, it's the issue of how does the World Health Organization include civil society more? The World Health Organization is its member states.
Right.
Secretariat doesn't get to make that decision. I can tell you right now what Mike Ryan would like. That doesn't matter. What matters is what 194 ministers of health decide around inclusion. And I think that's where your problem lies at times, because very often that lack of inclusion at national level gets reflected at global level. We're just a reflection of what the realities are on the ground for NGOs and civil society organizations. Why would governments that exclude civil society at national level come to the World Health Assembly and say, hooray, you're all welcome, you know? It doesn't happen. So we're a reflection, sometimes a wonderful reflection of solidarity and a wonderful reflection of the spirit of equity, and sometimes we're a horrific reflection of injustice and lack of inclusion. But we reflect that through the mirror of the member states. So I would like the member states to look at that, right?
Yeah.
And to see that reflection. How are they reflected globally? And to really have a hard think as member states around how civil society can be better included in that whole dialogue. And yeah, the official member state. And the other part is, you know, you get to the assembly, there's a very long afternoon, 753 member states make interventions, and at the very end there's a rushed process as everyone's waiting to go to whatever reception or coffee, and now we'll have the interventions from civil society organizations in official relations with WHO, at which point everyone gets up and leaves, right? Yeah. I mean, the positioning of civil society interventions alone, just where they are in the whole process, it's an afterthought. If you perceive yourself as an afterthought, and every time you come to the World Health Assembly you get to speak at the last moment with the chair saying we've now reduced the speaking time for 28 seconds for everyone, and someone tries to get a 3-minute speech into a 1-minute slot, I think that's not the best way to show that civil society is welcome in our governing body. But I would put it back to the member states. Just while I have the floor, going back to what you said about PIP, because I think it's an important point. Yeah. Act A and COVAX demonstrated some solutions. The pandemic influenza framework demonstrated some solutions. Just to remind everyone that we work every day. We have global equitable solutions. We distribute cholera vaccine, yellow fever vaccine, meningitis vaccine, and Ebola vaccine to the world free, purely on the basis of epidemiologic need. That is done with UNICEF, WHO, the Red Cross movement, MSF, CDC Atlanta, and others. We pool our money, we purchase, and then we have a process of allocation that is purely based on epidemiologic parameters. So I think it's actually possible to achieve that. The problem is, and the trick is, can we achieve that globally during a pandemic?
Yeah.
That's the issue. And I think there's lessons to be learned from the ICGs, the PIPs, the ACTs, and I think we need not ACT 2.0 or PIP 4.0. We need a new way. We need an evolved, different way, different from all of the existing processes, but a new way that reflects the realities that we face today.
Thank you, Mark. So we're back to that learning machine again. What have we learned from these different processes? What have we learned during COVID about equity? And what do we actually forget because we've gotten used to it? I was around when the PIP framework was negotiated. My God, was that tough? Was that difficult? And I hear that, the ambassador who helped negotiate that is actually back to help negotiate some of the Act A issues. But everyone, you talk to people about global health governance, practically nobody mentions the PIP framework because, also it works.
Yeah.
And this is, again, really interesting. How do you, in global governance and also in relation to WHO, get people to talk about the things that work? Mm-hmm. And this, I think, is perhaps one of the greatest challenges. But Björn, you wanted to come in on the NGO issue, I think.
Yes, indeed. I wanted to contribute because I had, at least with one other colleague in the room, the questionable pleasure to, in this case, lead the German position in the negotiations on FENSA. And that was really, it took 2 years. It was really think about, well, one would have to think about how valuable this process was. But it's important to recognize that to a large extent, FENSA focused on one aspect of engagement, and that is primarily who WHO should not be engaging with, namely specific parts of industry. Our point, or where we came from, is actually the Constitution. The Constitution mentions, and you said it rightfully, that WHO is the leading and coordinating authority in international health or global health. Well, who is WHO supposed to lead and coordinate? Is this member states or who else? And our position was, well, global health has changed since the creation of WHO in 48. It's not only member states who are leading global health. Obviously, it's lots of other actors, state, non-state actors, civil society, private entities. And so global health is shaped on various sides, to the better and to the worse. And if we are honest with enabling WHO to be the lead and coordinating authority, it needs to be able to engage with practically everybody who acts and who has influence on global health, whether they do that in a positive way or in a negative way. That was our position. Is it possible or thinkable that civil society or non-state actors are involved in decision making? No. The true answer is no. And that, I guess, will not be different in the next 10 to 30 years. But I think there is room for improvement with regards to decision shaping. And there we are not exploring what we could be doing. I think there are good proposals on the table, like the Committee C idea that is currently coming up again. So a hosting of non-state actors before the Assembly, a pre-discussion in order to inform member states delegations. So member states delegations are informed by civil society and then take a decision. I think the decision shaping will be, the decision making will be done by member states. That's the prerogative, and I doubt that anybody is able to change that.
Thank you, Björn. And as I say, you just have to be around long enough, then your suggestions actually come to be looked at again.
And Ilona's was the Committee C.
Yes.
Yes, you've been slogging. That was yours.
So really, really interesting how long innovation processes also take.
Yeah.
And how long learning processes take. And we saw with the pandemic, some things we learned very quickly, but others, also because of other issues, become much more difficult to take forward. And I'd like to turn to you now, Helen, with a mix of a question which partly relates to what Larry wanted to answer on geopolitics, and how can we actually have good global governance? And I come back also to the points Mike made, when it actually basically comes to a halt if the election in one major country brings somebody into power who is opposed to the multilateral system. And of course, this didn't only affect WHO. Remember, it affected G7, it affected G20. Decision-making became impossible. How can we build a robustness into the system? Do you see that from your political experience, Helen?
Well, perhaps just put in a word on the last debate. I agree with what Björn said. I think the decision making at WHO is going to be a matter for the member states, but the key thing is the meaningful engagement of civil society. And as Mike said, 28-second contributions at the end of the last day aren't meaningful engagement. So it's a question of how you design processes so that there can be full and considered input by civil society. So I think enough's been said about all that. It seems to me that if you can't get global agreement on health, which is so fundamental for every single human being on earth, what on earth can you get agreement on? If we have to try and carve out any area where we try to bridge across geopolitical divides, can it not be something as basic as dealing with existential threats to our health? So I would just continue to urge the diplomats who negotiate around these areas to look to try and carve out as much space as you can to find agreement on health and not see it linked to to other issues. I mean, climate change is in a similar barrow, isn't it? That we need this work to go on, regardless of the geopolitical tensions. And if you then spin it around the other way, if you can find a space for dialogue and cooperation on health and on climate, maybe that in turn is productive for discussion on other issues as well, you know, sort of building confidence, as it were. But I don't pretend any of this is easy. And you're right, a major change of stance in a major country can have a devastating effect, as we saw. Well, I can say it, I'm not a diplomat, through the period of the Trump administration. It was disastrous in so many ways for multilateral cooperation.
Thank you, Helen. And of course, that is also something that will significantly influence the UN summits that are upcoming and where one has to be well prepared. Larry, do you want to add something on geopolitics? You were ready for it.
I was ready. I mean, there's just no question. I mean, you're right, Helen. I mean, you've got, and it wasn't just in the US, you know, you've got, Hungary, you've got Brazil, and then you've got authoritarian governments in countries that will be left unnamed that really make global cooperation difficult. And that's why, and maybe it's just because I'm a lawyer, but that's why I do believe that we're at a pivotal historic moment. And WHO and Geneva is at the center of it. So is New York. You're right, Ilona. I think you need that political muscle, but it needs to be in support of WHO as the nerve center. I think that's really crucial. So we have to find ways, and it's not easy to kind of break down rigid sovereignty. There's always going to be some national self-interest, some sovereignty that comes into it, and people, will put their countries first. Even Barack Obama did that during H1N1. But we have to break down the kind of stubborn sovereignty where it really can interfere with, what we need in the world. I mean, I was talking to 70 government representatives on the pandemic treaty in Geneva recently, and they were all pushing against, One Health, climate, the idea of, prevention, preparedness, response, recovery. They're willing to talk about preparedness, health system preparedness and response, but deep prevention, One Health, climate change. And so I said to them, listen, I understand, sovereign governments don't really want to go there. You don't want to tie your hands, but we just look at each other as human beings. We all know, we just all know that is what's needed. We see it with zoonoses and the increasing pandemic threats. We see it with food insecurity. We see it with climate crises. So we've got to do it. And somehow I hope the pandemic treaty can, and we'll all do our best to push that.
Thank you, Larry. And we've all learned a new word, stubborn sovereignty.
Yeah.
So, go away with that, stubborn sovereignty. Was that a hand for discussions? Yes, please, go ahead. Is there a mic? It's coming, Arrow. Just. Yeah, I think, but it's about, people outside of this room. So, please. And introduce yourself, Eero, please.
Thank you very much. I'm Eero Lahtinen. I'm basically a health diplomat in Geneva, a colleague of Björn. So I would like to go back to what Mike said about the 80 agencies that work in a country. So WHO develops normative guidance for member states, and more recently WHO has also started to speak about normative guidance to other UN agencies. My question is, would it be time to reinvent normative guidance in the way that the agencies that work in countries would buy it, and that the governments that accept those agencies would require that WHO normative guidance is followed. So that would somehow coordinate, that bring together the issues. Thanks.
Thank you. Would you just pass it on? Is that Emma? Yes. Okay, Emma, please introduce yourself.
Hi, thanks, Ilona. Emma Ross from Chatham House. I want to pick up on this stubborn sovereignty question, which links to the question I had before that. So I wanted to ask, whoever wants to answer this, stubborn sovereignty, have to break it down. How realistic is it to cling to the hope that you could do it? Is to focus on, we've got to break that sovereignty. Is that a good use of energy? Is it realistic to think that is actually achievable, or, realpolitik? What is possible there? But I was thinking in the context of PIP, are there power levers that LMICs have that they could be pulling, like Indonesia did to get us to PIP? If we talk about equity, we're talking about the spirit, the principle, appeals for equity. Does anybody think that LMICs need to be flexing muscles that they might have that they're not using?
Thank you.
Indonesia.
Thank you. And one more here, just behind you. We'll do the three first. Sorry.
Thank you. I'm Dr. Rowan from Erbil, Iraq, and also board member of Kurdistan Health Summit, which is an example of World Health Summit in the national and the region. Actually, I will start with the translation of the word of architecture. We are talking about the global health architecture. In construction, if you have a worker who's not specialized and the materials are poisonous, so the building will fall down, like what did happen in Baghdad of a private hospital. So in the construction, there's no transferring if there is a bad building. But in the health, it can be. We learned from the COVID that a virus can be transferred from a continent to the other. So global health system and architecture, let's build an architecture and the designing to be unique in all the countries. Thanks for Dr. Ryan, that he's so practical and close to the scene. What's happening, more focus, and my question is that yesterday Dr. Tedros said that health should be brought out of the Ministry of Health, but this is not happening in our region. So, for example, when vaccines were distributed, the frontliners should have been the first ones who get the vaccine, but actually I was the last one after the models and after the the government people. So this is the reality. But at the end, so my question is, what is the plan for these region and these countries that to go beyond the Ministry of Health? Thank you.
Thank you very much. I'll start with Mike. I think there's 2 or 3 issues you'd like to pick up from these questions.
Yeah, maybe that last question and the other issue around, I think and this involves civil society as well. I think the thing we're missing, if we look at national action plans for public health security as a kind of a model for, or now the new process of UHPR, we want a plan in every country to deliver on health security. But what happens up to now is there is no overall government plan. If there is, it's in different places. It's not discussed openly. It's not out there on the web. It doesn't have objectives. It doesn't have a monitoring and evaluation process in it. The technical partners come in from outside and they do bits of that, and maybe they do things that are not in the plan. Then the donors come in and they pick their bit, and nobody actually has any oversight or overview of actually what's happening. We need much more transparency in the country support platforms where we can see the plan. What is the plan for the health security of the nation? Who are the actors and players who are going to come in and support the government internally, externally? What's the role of civil society? And what are the donors investing in? Because I don't see any transparency in that. And then that's where the competition starts. That's where the lack of transparency occurs. And this idea, ultimately, when people talk about sovereignty, and I believe in national sovereignty, I believe in national self-determination, but with national sovereignty comes accountability. If you say I'm sovereign, what are you sovereign in? You're sovereign in your responsibilities to your own population and nation. And how many governments are letting down their own population and then claiming sovereignty? No, don't look inside here. We're sovereign. But does sovereignty come with the accountability that's necessary to deliver for the population? We can have all the sovereignty in the world, Larry, as long as sovereign governments are responsible. Because sovereign, responsible governments will actually seek cooperation in order to meet their commitments to their own population, not to be nice to others. If I really want to serve my citizens, I will be reaching out internationally, looking for cooperation, looking for partnership, looking for investment, because that's my sovereign duty. So if people hide behind this word sovereignty and they say sovereignty is something we need to protect, no, sovereignty is something that needs to be leveraged for the good of citizens, not something to hide a wall to hide behind in order to isolate countries or stay out of the debate globally. Sovereignty, and every country is doing it. It's not just in the South. The number of there are countries who still haven't reported their cases of SARS from 2003 to WHO, and I can tell you they're not in the South. You know, so that was sovereignty and transparency. So I do think that, and that issue of the global, the architecture. We talk about that, and it's a great word at the moment, but it's more like an ecosystem, right? It's not going to be this, it's not a rigid thing. I don't think we're going to build this structure and everyone's going to be inside. The world has moved on. I think it's more about aligning all of those activities and looking at an ecosystem in which it's predictable, it knows what it needs to do, it's communicating well, it's coordinating well, and it reacts well. Because in the sports analogy, and one of the big problems we had, Ilona, in this pandemic is we counted things. When we were looking at preparedness, we counted things. We counted hospitals and we counted ambulances and we counted health workers. And it was like doing a strength test. Now, who would like to predict, who's going to win the World Cup next month in soccer based on what the teams can bench press in the gym a year ago? No. Because on the pitch, on the field, it's about strength and agility. It's about tactics. It's about behavior. It's a whole package of things. And unfortunately, when we measure preparedness, we just counted things. We didn't look at dynamic processes like decision-making, like inclusion of civil society, like trust, like communication. We didn't measure that. We measured, we have 16,000 beds, and of which we have 500 ICU beds, and we have 1,600 trained nurses. We just counted stuff. And I think if we're going to get better, and going back to our colleague from Erbil, and is if we're going to get better, we have to not think of it purely as an architecture, but as a dynamic system that needs to react to dynamic changing events, and building the resilience into the system to be able to absorb a hit, absorb a challenge, and then react and adapt to that challenge. And unfortunately, the emergencies are coming and coming and coming. So we're not going to have 5 years to the next pandemic. We are constantly reacting now to multiple emergencies at the same time. So building that resilience into the system, but also building that accountability into the sovereign national systems.
Thank you, Mike. And maybe two things to highlight here is that, at one point, people were still talking about a system in wartime and in peacetime using that terminology. And I guess you would all agree that's over. That's over not only in relation to ongoing outbreaks and pandemics, but also the interface, the cascade with all the other crises that also Larry mentioned. So I think that's one thing, and that means we need to have a feeling for those dynamics, which is why some of us who are political scientists and social scientists have said, you might have done better if you had spoken to us earlier, because we do know about processes, and that means that we need to understand that, including trust building. And some of the most interesting material and data that have come out now is that countries that had high levels of trust had better COVID-19 responses. And we have to think what that means, because the action about that is rarely in the health system. It's elsewhere. It starts whether you teach your children about democracy, for example. Helen, if you think of these questions, architecture versus ecosystem dynamics, rather than, saying, okay, global health architecture, which bricks do we need to put where now? How does one create and manage it's self-created to some extent, this ecosystem? How do we manage it, particularly if we see WHO as a brain, which is more of a rhizome than...
I think the the national level and getting it right there is so critical. The countries that were able to have this broad whole of government, whole of society response, because, as you say, had certain levels of trust, did better. And I think what every country should be doing systematically as we speak, if they haven't already, is to review the national experience of how they handled COVID, because no one got it 100% right. It was a longer spectrum of responses. I mean, I come from a country which, actually did pretty well for quite a while, but even in New Zealand, you see the social consensus now fraying around the measures to be taken, because it has gone on and on as the pandemic goes on and on. So there's a lot of learning to do out of this, I think, about how we update our arrangements at the national level, keep people engaged and mobilised. And then I think if we take that to the global level, and one of the things we haven't discussed today is what is the global leadership level that we need to try and build in. And as is well known, the independent panel took a position on this and said that it would be helpful in the continuing mobilisation of resources and awareness and preparedness to construct a council at the leader level, which would also have representation from other sectors, to just always be there as that watchdog and, if you like, accountability mechanism that things were happening. I think in a lot of the discussion, there's a lot of agreement that there should be such a council. The debate really is about where it should be situated. We made a pitch for it to be outside the WHO constitution, because we felt that what is involved is so much broader than health. But there's a real debate to be had about how do you construct it, what are the roles are, where would it sit. I must say the roles that WHO set out in its white paper are actually roles that we would envisage for the council. So the whole issue, I think, really is about location. But in a sense, that may not be the major issue. The key thing is to have an ongoing, I think, cross-sectoral, cross-regional leadership level oversight, which can be very helpful to WHO in its role as the nerve centre and leading on global health. So I think that there's some constructive debates to be had about all this in the run-up to the high-level meeting next year, and as negotiations go on around the Accord and the pre-negotiated platform and so on.
Well, I actually think location is more than symbolic.
It is.
There would be discussions around that. And of course, historically, there was a reason WHO is not in New York, but in Geneva, if we look at the history of the League of Nations. But geopolitics catches up with you everywhere, as we have also experienced in Geneva. Larry, how would you govern the ecosystem?
If I only knew. I mean, how do you govern, the ecosystem? I mean, I did support your proposals, and I do also agree with Ilona. We have to figure out where it sits. I've always thought that WHO is where I began, has to be at the center of it, because it's got the constitutional mandate, as Mike said, it's got the democratic accountability that other actors don't. But I do think there has to be a role for New York, because you need to have political muscle behind what WHO is doing. And, so right now we have an enormous challenge ahead of us in how we coordinate all this. How do we coordinate between the processes that are going on in Geneva with WHO Sustainable Finance, the pandemic instrument, and IHR? How do we look at the role of the General Assembly or the Security Council in terms of supporting that? Those things are really, really crucial. And then I would just kind of also go back to a thing Mike said. I can say a mea culpa, because I was on the board of the Global Health Security Index, which ranked the US, the UK, and Europe as the best prepared, and it didn't turn out that way at all in terms of trust. And then in answer to Emma's point about, the real politics of so-called, stubborn sovereignty, and what leverage does the low and middle income countries have? Well, I would think there's a couple. I mean, one, I wouldn't like to see it exercised, but Indonesia did have leverage, but it had leverage in ways that we want people to share their information, and we don't want them to withhold it. Another example would be South Africa. South Africa did what we want every good citizen to do. They discovered the Omicron variant, they shared it immediately, and then they got punished for it with targeted travel restrictions. All of those things, I think, need to change.
Thank you, Larry. Harijat, you can have the last word. Ecosystem, where do you want to be as civil society?
Yes, so thank you. And Helen, meaningful. We all talk that CSO communities engagement should be meaningful. I think that definition is something that we all need to understand. You see us, you think about us, you want us, you get us there. I think that is the first step. And it is really funny that we needed a pandemic to tell us that we need to change. And but now I think we are trying, and how do we change? So the first step, what is that we don't need bigger solutions. We need local solutions for local problems, contextually relevant interventions. We need interventions which are not which are able to actually benefit communities at field level. We talk about decolonizing the global health architect, and how do we do it? I just want to give one example here, that in this room, the amount or the years of experience that we all have, if we just add up that and plan, which we have been doing, we are a force to reckon with. And how do we do it? First step is that we agree. I want to give an example that at IPPF, I work with IPPF, there was that there is so much racism, what to do? We agreed that let's, deal it with heads on. Let's talk about it. Let's get it in action. I think that's the point here. We keep on saying that we want to change. What do we want to change? We want it to be more, in the spirit of equity. I really like the word. I think that's the key takeaway. And also nothing without LMICs, not just a beneficiary, but they're on the table to discuss, to decide, to make decision, and to think together. That's the first step. Thank you. Yeah.
Okay, thank you. So you can see that Ilona and myself switched positions. So it's more or less my task to wrap up the session in the next 3 minutes that I still have. So the first thing I'd like to do is to thank all panelists, Helen, Hayat, Larry, Mike, but obviously also the moderator, Ilona Kickbusch, for this compelling discussion that we had. And obviously, I'd also like to express our thanks to the audience for your contributions of this session. We wanted to keep it as interactive as possible, although there obviously only is limited time to do that, which might be a learning exercise for us next time. I believe that our discussion was very, very rich in shaping the way forward for our plan for global health architecture post-COVID. The German government advocates for constructive multilateralism in global health with a fundamentally strengthened WHO at the center. I think that's clear, which is enabled by its member states to be the leading and coordinating authority. And we'd like to enable WHO not only financially, but also technically, potentially legally through new mechanisms in the IHR and obviously the pandemic treaty, and politically also vis-a-vis other global health agencies or other actors who are engaging in global health. Germany stands for a coordinated division of labor based on core competences, system-oriented action, as well as reforming existing structures instead of creating a bucket of new ones, which is the tendency of each G20 presidency, but also G7 presidency, which we are currently holding, by the way. Only in this way, the international efforts can be streamlined and the available funds deployed more efficiently and effectively. I'm not really sure whether I'm a fan of ecosystems or architecture. What is clear to me is that
We'll call it the ecotecture then, will we?
Ecotecture, fine. Whatever we are building, whether it's a house or a forest or whatever, normally you would need to have a plan to do so. And I think it becomes clear that nobody seems to have a plan. Also here in this discussion, we were unable to map down a plan. What we were mapping down, I think, to a large extent are principles that you can apply. Better governance, trust, transparency, acceptance of criticism, voice of civil society, equity, community intelligence, a system based on incentives, end of a charity model, resilience, etc. All the big words that were mentioned here. I think it's clear that none of us seems to have the right plan. Interestingly, at I think a minute ago or 2 minutes ago, Hendrik Schmitzky-Nott from WHO just entered, I think, which reminded me that indeed there was a plan, or there is one plan that at least Germany is very much supporting together with Ghana and Norway, which to some extent aims to address the over-fragmentation and the non-coordination among the various actors, which is the SDG 3 action plan. However, it's not, in my personal perception, not lived up to the spirit yet by everyone. There is a considerable amount of work in front of us to be done, shaping global health further. Hopefully at some stage, we are all sharing one plan and vision. Speaking for my ministry, I'm glad that we had the privilege to be discussing this here together with so many enriching perspectives. We committed ourselves to take what we heard here, discuss it further, consider it further, and then, be inspired by it for our upcoming debates in Geneva or New York or elsewhere. So thanks a lot. It was a real pleasure. Thank you.